Hi everyone, my name is Alica Beutel. As part of ESDO Learning Bytes, I will give you a brief overview about prevention and management of chemotherapy-induced nausea and vomiting. Chemotherapy-induced nausea and vomiting, CINV, belong to the most distressing side effects of anti-cancer therapy, including chemotherapy, targeted immunotherapy, or radiation therapy. It can significantly affect patients' performance status and quality of life. It may result in dehydration, metabolic imbalances, malnutrition with cachexia, or finally withdrawal from potentially useful or curative anti-cancer treatment. The most important factor for determining the likelihood of emesis developed during chemotherapy is the emetic risk of the substance used. Other factors may also be important, such as dosage or administration schedule. Individual patient risk factors include young age, female sex, a previous history of anti-cancer agent-induced nausea, little or no previous alcohol use, prone to motion sickness, history of morning sickness during pregnancy, anxiety, and high pre-treatment expectation of nausea. The severity of CINV can be classified according to the common terminology of criteria of adverse events. Chemotherapies are divided into 4 categories based on the risk of emesis in the absence of antiemetic prophylaxis. In the high emetic risk group, 90% or more of patients experience acute emesis. In the moderate emetic risk group, 30 to 90% of patients experience emesis. In the low emetic risk group, 10 to 30%, and in the minimal emetic risk group, 10% or less. In the right table, you see the emetogenic potential of single antineoplastic agents. Different types of CINVs exist. Acute onset nausea and vomiting usually occurs within a few minutes after administration of anti-cancer agents and resolves within 24 hours. The intensity usually peaks after 5 to 6 hours. Delayed onset develops in patients after more than 24 hours and can last 6 to 7 days. Anticipatory CINV occurs before patients receive their next treatments. It is primarily considered a conditioned response, which typically occurs after a previous negative experience. Breakthrough CINV refers to nausea and vomiting that occurs despite prophylactic treatment and/or requires rescue antiemetics. Refractory CINV refers to nausea and vomiting that occurs during subsequent cycles when antiemetic treatment has not been effective. It is important to acknowledge other potential causes of emesis in cancer patients, such as bowel obstruction, brain metastasis, uremia, malignant ascites, or pancreatitis, just to name a few, and to treat them accordingly. Prevention is the main goal of antiemetic guidelines. Correct usage of antiemetic regimens can effectively prevent vomiting and to a lesser extent nausea in most patients with cancer. Guidelines for antiemetic therapy according to the estimated risk of CINV are available, for instance, from ASCO, NCCN, and ESMO. For high emetic risk antineoplastic agents, a 4-drug combination consisting of a neurokinin-1 receptor antagonist, a serotonin receptor antagonist, dexamethasone, and olanzapine should be used on day 1. Dexamethasone and olanzapine should be continued on days 2 to 4. In the moderate emetic risk category, patients should be offered a 2-drug combination of a serotonin receptor antagonist and dexamethasone on day 1. In patients who are treated with agents known to cause delayed nausea, like cyclophosphamide, doxorubicin, or oxaliplatin, may be offered dexamethasone on days 2 to 3. Patients in the low emetic risk category should be treated with a single dose of a serotonin receptor antagonist or a single 8 mg dose of dexamethasone before antineoplastic treatment. For patients receiving chemotherapy with a minimal risk of causing emesis, antiemetic therapy should not be administered routinely. Thank you for your attention.